Okay, hopefully you can all hear me, but we are going to get started with our Long Hauler Healthier You Sanctuary live session on Facebook. I'm going to watch and make sure that this is coming up on my screen here in just a moment, since there's the time delay. So with that, when you do hear this, let me know that your sound is working and we can really dig into things, but I don't want to take a chance that sound is not working. There we go. All right. So welcome everybody. I know that we are on here, or at least it looks like we are. Never have quite figured out the timing for yes. Good. Okay. So, if you're here to hear about long hauler COVID and ask some questions about this thing called COVID-19, then you're in the right place. So, our main topic is going to be long hauler COVID. We did an earlier session on this. Actually, I know what one issue is. We're fixing a microphone. There we go. All right. We're having a little feedback on the volume here. Actually, probably the fact that I'm hearing myself. Yes, there we go. All right. So let's try to get started on that again now that the microphone is in a better position and it's not hearing me speak and getting feedback. Long hauler COVID, part 2. We did this a few weeks ago. But because we are seeing a rise in the number of cases, whether you believe or not in a Delta variant, there are more and more people getting sick. We are having more of our patients reaching out for help with positive tests, with symptoms, and we're helping them. So with that in mind, yes, we are caring for those. We are helping those both with acute COVID, preventing long hauler COVID, and then we're seeing some patients who have been affected by COVID for weeks and months, and helping them to recover. If you want to learn and you're not one of our patients, we do have a course, Immune Prepper course, on how to make the most of your immunity, make it stronger, and to try to prevent these kind of illnesses, not just the virus of the day, but our normal viruses that we face. It's at our sfmempower.com site, our Immune Prepper course, and we have some other courses both there already, an allergy course, and others underway, including a mold course that when production is finished to be coming out. So I look forward to seeing the opportunity to help you, whether you're a patient or not. But for right now, all of you can enjoy the fact that we're going to talk about long hauler COVID, as much as we'd rather not hear the word COVID ever again. So with that, we can't deny the numbers. Those who have COVID acutely have about 10 to 50%, depending on which study you look at. Also depending on whether or not you're looking at hospitalized patients or asymptomatic or mildly symptomatic patients, have COVID. Now, interestingly, the chances of post-COVID syndrome, having symptoms over 4 weeks after your acute illness is over, is actually higher in the 40 to 60-year-old range and in those who had milder disease, but definitely in the 40 to 60-year-old range, whereas it is the 60-year-old and above who have the most risk for actually dying from COVID. So there's some different things that we're trying to understand in medical research. Why is that? We don't know yet. So let's look at the review of symptoms. So patients who over 4 weeks after their acute disease is over with are having mainly some amount of fatigue. That's the most common symptoms that people are complaining of. Fatigue, not just, oh, you're tired one day and you need to sit down for a minute, but fatigue that they're not able to work, that's interfering with life activities, it's stopping them from doing what they want to do. Beyond that, there's headaches, there are GI symptoms, abdominal pain, dyspepsia, upset stomach, a lot of palpitations, and then there's a decent number having postural orthostatic tachycardia syndrome, or some type of dysautonomia. Dysautonomia meaning just the fact that your nervous system that controls automatic processes isn't working. So when you stand up, instead of compensating blood pressure and pulse, it goes a little haywire. And people, if you know someone with POTS, P-O-T-S, you know that they feel pretty miserable and often can't function very well during the day. A lot of breathing symptoms and shortness of breath, post-exertional fatigue, or just the fact that they try to exercise and they get winded too easy. So there is a big issue with that. And a lot of other issues that we're all learning about. So there's concern for autoimmune conditions. Up to a month after the acute illness, there's a chance of blood clots. So we're seeing strokes, peripheral blood clots, even lung pulmonary emboli, lung blood clots that can be life-threatening that are happening later. So with that, once though we hit that 4-week mark, by that time most viral illnesses, about 3 to 4 weeks after the viral illness, not just COVID, should feel better, meaning that they're kind of back to normal for the most part, doing what they're doing before. We're seeing patients months and some that are severe, even a year after they had COVID, are still suffering, which is a problem. And not just, oh, they're tired and not as productive, they can't run their 5-minute mile. It's, oh no, they can't run a mile without being wiped out or short of breath, or they can't go to work. So that's much different. And even some people that are athletes. The other neurologic symptom I forgot to mention is tinnitus, ear ringing. So with that, looking for the reason that this happens. So we know in functional medicine about other post-viral syndromes. We've been dealing with patients with Epstein-Barr, post-CMV cytomegalovirus. They're left over from herpes family viruses having infections, HHV6 included in that, or post-Lyme, post other chronic infections. So with that, post-mycoplasma. We know that sometimes patients' immune system gets dysregulated. We often see autoimmune antibodies after Epstein-Barr, during and after Lyme, and then with toxicities like mold as well. But we know that there's autoimmune conditions, there's chronic inflammation. We know that when we're sick with, say, the flu, you feel run down. You just don't feel as good if you've got a cold. So imagine feeling that like that long term, because there's some ongoing inflammation there. So there's probably at least some immune dysregulation, potentially some autoimmunity. One of the papers that came out is looking at endothelitis. So what is that? Inflammation of the blood cells that are the cells that are lining your blood vessels, meaning those ones that kind of make up the blood vessel itself to keep the blood in and keep everything else out. Those cells look like they're being attacked, potentially by autoantibodies, inflamed, and then instead of necessarily having the blood clot, it's those cells are inflamed and closing down the blood vessels, and maybe not all the way, so you get what we call a microangiopathy, meaning the small, if the blood vessel is this big, goes to here, it's not great, it's not terrible. If you have a blood vessel that's already small and it's almost closing down, but not quite, it's not quite a stroke, it's not quite a blood clot completely, but it's hindering the amount of blood that gets to muscles, to get to skin, to get to brain, to get to other body organs that need that wherever that's happening. So we have inflammation in the in the cells lining the blood vessels. We have a decrease in the blood flow to those organs or those tissues, and then we have effects from that. So that is part of it for some. Some are asking, is there an aspect of ongoing infection? Could this virus continue? Again, Epstein-Barr, CMV, herpes, people get fever blisters, we know that, and that can keep coming back and forth, because those viruses hide out in our nerve cells and then come out in the ganglion of our nerves, little bunches of nerves that sit there, the body, nerve cell bodies come out. So we see that. Epstein-Barr lives in lymphocytes. You have CMV living in liver and kidneys. You have HHV6 living in different tissues, potentially affecting the thyroid. So we know Lyme disease living in connective tissue. We know that is something that's ongoing in other infections. So why should you be surprised that COVID might be continuing? We know that with COVID there's some ongoing viral shedding in the GI tract. At least there's pieces of the virus that are coming out there. It does not seem to be lasting the months and up to a year, causing long hauler COVID, but it is some suspicion that is it just the fact that we cannot pick it up in there. So, and then there's just the fact that if you've had a bad infection, it scars your lungs. Your lungs are going to be at less capacity. If that infection affected your kidneys, you may lose some of your kidney function and there's some scar tissue. So we're looking at a multitude of reasons that someone may be having symptoms after COVID, and we also know that it's just, again, the same thing when we're looking at someone who's had, say, Lyme disease. It's left over some damage. It also causes ongoing inflammation. It has different effects. It can trigger autoimmunity. Why would we be surprised if COVID-19 doesn't do the same? So often patients have more than one reason. They had some damage, they had some autoimmune antibodies, they had a blood clot. Or they also, the other thing, central sensitization syndrome. So you're more sensitive to pain, stimuli, where your brain has been inflamed and is hypersensitive to things. So with that, we're looking for causes, so people want to understand it's science, and you out there wanting to know why you're still sick. So what are some of the things that we are seeing in our office? So for patients, sometimes they have diminished lung capacity. So if you do a pulmonary function test, they can't push air in and out quite as much. If they had some kidney damage in the ICU because they were hypotensive, low blood pressure, it may be the fact that their their kidney tests, like a creatinine, are lower. They may have some leftover brain inflammation, the blood clotting, and it doesn't really seem like it's just deconditioning, like, well, great, it's just because you were sick for 3 weeks and you're out of shape. No, it's more than that, because those patients should recover with conditioning, and a lot of the post-COVID patients are not getting better with just going through PT and exercise. And it wouldn't really explain why the younger crowd with milder infection are having long hauler COVID, because they weren't in a hospital bed for 3 weeks, or they were not on their back for 3 weeks. They were still doing most of the normal things, so there's no reason they should have gotten out of shape for a time. Now, one thing we have seen in our office is the fact that when we've had some certain blood tests that we use for biotoxins anyway, something like a TGF-beta-1, human transforming growth factor beta-1, that those are elevated after COVID, so that patients who got COVID went ahead and got their blood tests done 2 or 3 weeks later, and those levels are elevated, and quite elevated in some cases, and then we recheck 3 or 4 weeks later, and they've gone back down to normal. So the same lab that we were using to look at for mold or Lyme activity also is being elevated by COVID. Now, other infections can do that to a little degree. COVID, the ones we've seen seem to be a little higher. But it made me start suspecting that COVID had some biotoxin effects more than just being a viral infection. Which leads me to a paper, I'll try to post this in the comments, about Dr. Shoemaker, who is one of the 2 leaders in the world of mold detoxification, caring for patients who have been in contact with toxic mold. With that, he did a study where he looked at the gene expression using what's called transcriptomics. That's how active certain genes are. He'd been doing that for mold patients, Lyme patients, but he looked at COVID patients who had acute COVID and ones that had mold toxicity, active mold toxicity, and looked at the genes that were active, and they were the same ones. So it does look like there is an aspect of which COVID, at least acute infection, can be causing the same immune response, the same genetic response as mold as a biotoxin as COVID does. So with that, kind of confirmed what I suspected with the TGF-betas we were seeing in patients, and also we've had a few post-COVID long hauler patients where they have those levels elevated. The only question is it because they also have mold and post-COVID, or did the mold toxicity set them up and the post-COVID infection tipped them over and they got even sicker than they would have been otherwise? So we need research on that. But it's interesting that Dr. Tetz, T-E-T-Z, has done some research looking at Prion disease and the similarity of the spike protein to prions. Now, you may or may not have ever heard, if you listened to one of my little preview videos, you would have heard this before, but prions are a very unusual, if not unique, type of disease, infective disease. So normally we think of an infection requiring DNA material, either in a virus or bacteria. In this case, it's a protein, and it triggers a catalytic reaction of other proteins similar in the body to then replicate themselves without needing DNA. It just causes a conformational change in making that protein cause harm and sometimes stick together. Creutzfeldt disease, don't ask me to spell it, but it is a mad cow disease is another one. Mad cow disease is proteins in the brain that start building up and sticking together to the point where they are actually causing dementia and even death. So scientists know that prions have certain patterns in their genetics that make them more likely to be a prion and create these kind of diseases. There are some similarities, patterns, prion-like patterns in the spike protein, and make us wonder, is that one of the reasons why it's causing issues, is it's actually causing a catalytic response of proteins in the body. We don't know yet, but Dr. Tate's paper actually brings that up and asks that question. So with that, that also begs the question is, if you're injecting that in a vaccine, could that trigger some prion-like reaction? We don't know yet. Will we know? Will somebody actually step up and do the research? Have no idea. Hopefully some at least start asking the questions. We need real answers. So there's a lot of debate, but no clear studies to answer that one way or not yet. But as I said, we're also, besides taking care of long hauler patients, we're actually taking care of some post-vaccine reaction patients who have similar labs. I'm not going to get into the whole details of that right now because it's developing. And also I don't want to get pulled off of Facebook, but we are looking at that to see if there's some connections between the spike protein and the vaccine and some of the reactions we're seeing in patients. So otherwise, it also acts like chronic inflammation. So it disrupts systems in the body. Whenever you have chronic inflammation, it turns down mitochondria. So your mitochondria that normally convert carbohydrates, fats, and proteins into energy get dysfunctional. Your endothelium, those cells that are lining your blood vessels, have ongoing damage, and you don't get as much blood flow and oxygen to areas or nutrients. Your brain, you have a lot of cognitive, increased pain sensitivity, a lot of overlap with myoencephalitis or chronic fatigue syndrome. Also, those are known as fibromyalgia as well, where patients have the post-exertional fatigue. They exercise today and they're tired for 3 or 4 or 5 days or a week. And they're worn out. It's not just, oh, I'm a little tired, but it's they can't function for a few days. They're seeing changes on the heart. There are some decreased blood flow to the heart, and especially the vaccine, there's some myocarditis, but you're seeing changes in the heart muscle that we don't know how well it's going to recover over time. It's interesting. I'll hopefully be able to be in contact with the Stanford University researcher who's looking at long hauler COVID immune markers. So he's sent me from a patient a list of those markers, and I'll be studying those and seeing how to apply those to our patients. But he's doing a study right now, so it's not ready for prime time. But as always, in Sanctuary, we are trying to apply the latest. So as soon as I determine exactly if that and how that fits with patient care, we will begin implementing those things. The other changes I mentioned, we have seen autoimmune markers similar to biotoxins, mold and Lyme, can trigger anti-nuclear antibodies to go up. And it's interesting, the postural orthostatic tachycardia syndrome, the POTS, where people stand up, their heart rate goes up, their blood pressure may fluctuate, and they'll be really lightheaded, and sometimes they can't really function upright. It's looking like that a large number of those patients are turning out to have some autoantibodies of certain types. So POTS may actually be an autoimmune condition. So it's going to be very interesting because, again, we see mold patients who have POTS. Those mold patients that get better, their POTS gets better. And whether are we turning off the autoimmune response that we weren't even fully aware was there. But we're seeing that in not a super high number, but a significant number. There are some studies in mainline medicine that are confirming that some patients with post-COVID syndrome actually have this dysautonomia or dysfunction of the autonomic nervous system. The automatic nervous system that controls blood pressure, pulse, breathing, things like that. Temperature flow to different parts of the body as well. And there's some studies looking at whether those who post-COVID have increased thyroid antibodies, meaning that they may actually have Hashimoto's coming out of this. So what are the medical responses? In conventional medicine, there's some good things and kind of somewhat predictable. It's like, let's do some tests. Let's do an echo. Let's do pulmonary function tests. Let's do CTs on the lungs. Let's do CTs on the head. Those aren't necessarily wrong. They give some answers, but it's more of observational as they're waiting to determine what to do with those. Because they say, oh, let's do and some autonomic nervous testing, where you have a tilt table, they put people down, watch their blood pressure and pulse, move them up, and see if that changes abnormally to diagnose the POTS that we talked about a moment ago. And they generally start about 4 weeks, even though they're tracking these patients. They start treatment or testing around 4 weeks to give them time to prove that they are long hauler COVID and not just regular recovering from a virus. But with that, then they start looking at a lot of graded exercise, thinking, oh, if we just recondition the deconditioned person, then we can fix that. Or if they find a blood clot, yeah, they'll treat that. If they find a stroke, they're going to treat that as you would any other stroke. But there's a lot of watching and waiting and not necessarily being as active or even dealing with the chronic, say, loss of smell that I didn't mention earlier either as a neurologic symptom. So whether that helps or not, it's not clear. It just buys time because some people do get better from long hauler. But if you're one of those that stretches out months and you're not able to work, you would like to be able to get better a little bit sooner. So in functional medicine, we're going to talk about the terrain theory. And this is mentioned a good bit in our immune prepper course because it's not just about the bad guys out here, but we talk about the fact that our immune system is a defense operation. And it starts with what we do on our mucosal barriers, keeping things out, things that we put outside like immunoglobulin A, antibodies of IgA type, which are on the surface, mucous membranes, sinuses, our genitourinary tract, and our GI tract that catch invaders before they get in. And then how well our innate system, the things that respond first. So innate system are the cells that don't need to know if it's a strep or a virus. They just say, okay, bad guy, we're going after it, we're causing inflammation, and we're calling in more help. We're sending a message up the line to bring in helpers to kill that invader so that the adaptive system, which again, all these are described in great detail in the immune course, the adaptive system are the antibodies. So they come in and they target, oh, we're just going to, that antibody only hits strep, this one only hits COVID, this only hits EBV, this one only hits Lyme. They don't cross-react, they're very targeted rather than shotgun approach. That's when that kicks in. We want all those arms to be each working well and working well together. Together is like the Army, Navy, Air Force, Marines working at once in a unit and as a unified force are going to do better than any one of those operating singly. So with that, we're going to approach things. Terrain theory means we want to make sure your terrain is good. If you have good defenses, it's less likely you're going to get infection. And then if you have a good terrain, when you get infection, it's not going to be as severe and you're not going to suffer as much from that. So we want to remove, trigger any other things, toxins that may weaken the system. And we want to make sure that any deficiencies are addressed. So we want to make sure zinc is good, vitamin D, vitamin C. Your need for C goes up greatly during infection, so we want to make sure it's tanked up well to begin with. We go through all these in the immune course again, but we are trying to make sure that your defenses are as strong as possible. And if there's any saboteurs, like toxins, heavy metals, mold toxins, other infections, chronic infections like Lyme that will suppress the immune system, or Bartonella, that they are out of the way and your immune system has got an A+ ready alert rating. And then we can augment the natural healing. And the other thing, looking at the fact that lower vitamin D levels are going to increase your chance of COVID. And there's at least one paper, if not a few out there, that point out that the lower your glutathione level, the master antioxidant for your cells, the lower it is, the higher your risk of severe COVID. So we're going to start early. We're not going to wait till COVID knocks at your door to try to lock it and try to bolster this defenses. We're going to help you do it from the beginning. So with that, I've got some questions already, but anybody that wants to leave them, I'll be looking on here on Facebook, and we will try to answer those. But I'll start with the ones that are already sent in, and I will try to include the links to the Shoemaker and the Dr. Tetz paper on there as well when I get a chance. So, first question from Miss Caitlin, 32-year-old healthcare worker, Hashimoto's, compound heterozygous MTHFR, always taking the flu shot, but have declined the COVID vaccine. Now unexpectedly 7 weeks pregnant, congratulations. My doctor really thinks I need to get vaccinated to protect me and the baby. Don't feel comfortable taking it all pregnant, since taking it all while pregnant, I didn't before. But I've heard horror stories of pregnant women dying of COVID. What's the best thing I can do to protect myself and baby to prevent getting it? And God forbid, I did what should I do? Thank you. So, first of all, again, congratulations. That's a tough situation to be in. It's one of those times when you're like, oh, not just you, but you're caring for a little one inside that obviously you want to have a healthy start to life. And we help many women, even before COVID, have healthy starts for them, healthy pregnancies and healthy starts to their children. So with that, though, again, we would approach this as we would anybody else, with or without COVID, is we want to make sure the immune system's strong, whether it's vitamin D. Now, not too much vitamin C. Excess vitamin C during a pregnancy can increase the risk of birth defects. It can be a problem, so just up to 250, 500 a day total. Don't overdo it. Vitamin D is safe. Omega-3s, glutathione to a small dose. Don't try to detox while pregnant, because then you're flooding the baby with toxins as well. So after that preparation, then right now Ms. Caitlin is in a situation where should she get the vaccine? Yes, there are some women who've gotten COVID while pregnant and died. There's also many women who have gotten it and not died. It's not been as severe, and it's kind of debatable if you're at that much more risk of severity than otherwise. With that, there also is a question, you're injecting a vaccine that has a gene program into your body during a time in which your baby is developing and incorporating genes and expressing genes. So there's a question of whether or not that's a good idea. Since we don't have studies, they can say it's approved, it's recommended, but it's really hard to be absolutely, because we don't have the results of studies to say that is a good idea or not. Now, with that, there's also the fact that first trimester, there's more development going on. There we go, I think it's back. Let's see. Yes. All right. I think we are back on now. Maybe, maybe not. Yes. Yep. It looks like we're going again. So, not sure what that technical difficulty was, but the hiccup hopefully is behind us. I was just finishing up talking about whether or not to get a COVID vaccine when pregnant, and just talking about a patient who has been injured in the past. So I would not advise that patient who's already had one autoimmune disease and severe effects from it, requiring medications, to go out and get another vaccine. And I would be careful, at the very least, consider waiting until a later trimester rather than doing it when you're only 6 months pregnant, especially when there's been case reports of women having miscarriages in the week after the vaccine, or whether they'll admit that or not. So with that, next question, Ms. Lambert, for those of us who are currently trying to detox from biotoxins, any other protocols which would be helpful for preventing COVID infection? Will glutathione, quercetin, vitamin C also help with prevention? The way we're approaching it is I cannot say certain nutrients do or do not cure COVID, but I can say, as I do in the immune course, the fact that there are many nutrients that will augment your immune system that have been shown in studies to lower the chance of viral infections. Things like D, vitamin D, zinc, vitamin C, those definitely help. There's at least some good evidence out there that those who have a higher level of glutathione also have a lower risk of severe COVID infection from the acute side. Whether or not that will help with long hauler COVID is a question. I am using glutathione for those patients who have symptoms. Actually, if they're one of our patients and we treat them for acute COVID, what I'm doing is I'm even treating them starting with a higher dose of glutathione to try to prevent post-COVID. Don't have proof right now, but given the fact the mechanisms of action for what long hauler COVID looks like it's doing is chronic inflammation is one of the biggest things. So using things like glutathione, curcumin, omega-3s, and then continuing things like quercetin, Quercetin, depending on how you pronounce that, and making sure the vitamin D levels are good. There are some few other things out there that have potential for being furin inhibitors, other mechanisms of how it stopped the virus from replicating, but we're not sure that for acute COVID, they're probably helpful, but whether or not they're long hauler COVID is a question mark. Can loss of smell and taste be prevented during a COVID-19 infection? If so, how? Again, I would say prevention. So making sure those cells, it's looking like the cells around the nerve. So the nerves for your smell go from the top of your nose, through the bone, up to your brain, and connect directly into your brain. With that, it looks like the cells supporting the nerves are the ones that are actually getting damaged and infected. It's not the nerves themselves. So having things like zinc, probably zinc would be the biggest one in terms of helping the mucosal health, but probably also vitamin A. So the mucosal surface, the surface of our sinuses, would be good, but there's not a study that tells you or me, yes, better levels of this. But again, for lowering inflammation with antioxidants, keeping your mucosal terrain in better shape, you're more likely to be benefiting from that and not having that. But nobody knows quite yet. Are there less long hauler issues likely with the Delta variant of SARS-2? We really don't know because it's just come out in the last month or two. We don't know if it's going to have more long hauler or less. And to some degree, even the things that are being claimed to be known on the news right now are hard to say because somebody pointed out, well, how do we know this is all the Delta? They don't test everybody. There's not a Delta test out there. They do screening. They pick a number of ones that they've gotten samples, and they look to see if there's more of the variants out there, but it's not a definite, we don't know yet. We probably won't know for another month or two whether the Delta variant has an increased risk of long haulers or not. Another question was about whether or not it's safe for those that have mold toxicity to get a COVID vaccine. It could be dangerous. So let's back up and say, are those with mold toxicity more likely to have COVID? There's strong suspicion that the answer is yes, but there's also in our community of practitioners concerned that those patients could also be at higher risk for the vaccine effects, especially one that's putting spike protein, because if it is a spike protein that's acting as a biotoxin, as I mentioned earlier, then that same thing that's in the vaccine and the infection itself could be triggering those reactions. So we don't know, and we're not going to get answers from mainstream medicine because, one, they don't believe that mold toxicity is real. So hopefully, as the group of us come together, we can put our patient numbers together and see if that turns out to be true or not. So right now, given that if you have mold toxicity, your immune system is almost by definition dysregulated. Almost all mold toxins do that. Then there is a chance that you will have both a less efficacious response to the vaccine and potentially more risky side effects. Don't have proof. That's just my suspicions at this point. So I'm going to look to see if we have any more questions. So yes, it's not really a question from Jenny on here, but about having the MTHFR gene and making appointments. With the MTHFR gene, that is one where there does look to be an increased risk for smallpox vaccine and potentially other vaccines. One of my patients actually sent me some research they had done. That was literally yesterday afternoon. I just found it this morning. I need to look over that, but those who have especially a 677 double copy, homozygous copy of MTHFR, may be at a little bit increased risk of side effects from vaccines in general, and that could carry over to the COVID vaccine itself. So let's see, trying to pull up some more comments. Having a little trouble seeing all of them. It says I have 23 comments, but I'm not quite getting all of those. I'm going to look at my other screen over here and see if I can see more. I'm going to make sure we don't miss any questions. Here we go, I can see those. Why haven't they tried using EPO on hospitalized patients? Elevates oxygen load and protects renal systems. EPO, there's a couple of things out there that, if you could, Dwayne, if you could clarify what EPO is, because there's a few acronyms, just so I know I'm answering their questions. Is that erythropoietin? Is that eating primrose oil? Let me know what that is. And yes, we will post the live stream again. Also predict still about EPO. What's the recommended dosage for glutathione, berberine, zinc for prevention? So the glutathione, for a lot of our patients, we'll use in the 250 twice a day up to 500 twice a day dosing for our patients. With that, those are reasonable dosages unless you're potentially having a detox reaction. If you have a lot of toxins, you may find that you're sensitive to glutathione, so I'd make sure that you're running that by a doctor first that you have. Hopefully you have a functional medicine doctor that you're already connected with that makes sure there's no reason you shouldn't do glutathione, or that you're not having some sulfur issues, because glutathione is high in sulfur. You may know some gas, and if too much sulfur, you can also sometimes get nosebleeds. So to be aware of that. For berberine, right now there's not a definite study, but doing 500 a couple of times a day, milligrams of berberine, B-E-R-B-E-R-I-N, is probably reasonable, definitely safe. Be aware it can lower your blood sugar. It can also, if you're taking higher doses, change your gut microbiome, and can act as a little bit of an antibiotic at higher doses. And it can also help balance hormones, especially if your hormones are being imbalanced by high blood sugar. But be careful with that on berberine. And zinc, short-term zinc, 15-20 milligrams a day is reasonable. You do want to be careful. For short-term use, you can go up to 50 to 60, 70 milligrams, but you can start losing your smell or taste from too much zinc, or tasting metallic, so you'll think you have COVID when it's just the zinc, and cause a lot of upset stomach. And again, taking it too long can drop your copper, so talk to a doctor before you do it. These are all educational. You need to make sure that you're getting good guidance and know what your levels are in the first place, and not causing more problems by trying to do something on your own. Jenny, have a strong history of autoimmunity. Daughter type 1, since 18 months. Celiac, age 6. Crohn's, that's my mother, 4 daughters. Vaccines triggered these. Felt torn about the vaccine versus actual virus. 2 of my daughters, including the one who had type 1 diabetes and celiac. Did find what tests can be done to see if there was long-term damage. Fear my other 3 daughters would develop an autoimmune disease. So I'm not sure if you're saying they did get the vaccines or have not, but yes, celiac and type 1 are related. I have a child with type 1 diabetes, and for a number of years, they're doing fine now, but yes, I'm concerned doing vaccines in those without autoimmunity, just in case those vaccines are triggering more autoimmunity. So we need more studies, and not just closing your eyes and saying, oh, it's going to be okay, it's going to be okay, it's going to be okay. We need real studies that give us real information, so we're not having to try to figure things out without those. Yes, there's concerns, and there's not a good answer on what you need to do in terms of mitigating side effects of vaccines, except like I said, the anti-inflammatories, glutathione, omega-3s, curcumin, to lessen that. But there's, people ask me, oh, how do you detox from the vaccine? Well, the vaccine itself, you're not detoxing from. You might detox from the chemicals in it, and those detox therapies, the vitamin C, the glutathione, those are helpful. But you're not detoxing from it itself, the vaccine itself. Answered about the smell and taste during COVID. Thank you, Marilyn, for sharing your experience with the immune course. We had our first inaugural was a live interaction where once a week I spent time with the students. The current one is one in which you watch all of these at your own pace. A few hours worth of basic explanation of the immune system with tips on how you can improve it. But at some point we'll look at probably doing the live course where I'm actually doing a Q&A session, answering questions for you. If enough people request that, that is something we could look at doing again. The new course for Ginny is on our SFM Empower site, which I think Ron posted that for me. Talked about the MTHFR. And yes, Ginny, the other question just as far as for kids, I'm certified in both pediatrics and board certified in pediatrics and internal medicine, so we help a lot of pediatric patients finding the right quality supplements at the right doses, including if your kid can't do capsules. I've had some children who just cannot swallow a capsule to save their life, and we find liquids or help what you can crush or mix in food and make the supplement smoothies, we call them sometimes. And to be creative in how you hide some of those flavors in your kids that are picky tasters. That's now. Dwayne, I haven't seen on there just what EPO. I'm going to assume for a moment that you're asking about erythropoietin. So erythropoietin is a drug that stimulates your bone marrow to make more blood cells, and whether or not having more blood cells would actually increase blood flow and therefore oxygen to those areas, carrying to tissues that are deprived. So if it is one of the side effects or one of the causes of the symptoms is the fact that you're not getting enough blood flow from endothelitis, that might help. But you can also get too much erythropoietin, your blood count get too high, thicken your blood, and could slow the blood flow. So it depends on if someone who is anemic might benefit from erythropoietin, the EPO, but someone who's not anemic might actually be hurt by it or could increase the risk of blood clots. So it's a tough one. I haven't seen any information on that yet or not. Yay or nay. All right. I have time for a few more questions if anybody has them on there. Appreciate all the ones we've had so far. So I'll take a moment. Any other delay questions that anyone has? So when somebody comes in here at the last minute with a question, I'll bring the long hauler talk to a close. We talked a little bit more about acute, but I do want to bring us back to for a moment to long hauler COVID. Again, this all gets back to dealing with the terrain theory. It's not just about what's out there in the world that might be dangerous to us. It's not just about what variant, delta, epsilon, lambda, omega, whatever. We're all hoping to get to the end and we run out of variants, but it is about making sure we're ready. Our bodies, our immune system are ready. It's just like we do, my son and I do some martial arts training, something called Krav Maga. It's Israeli self-defense. With that, our teacher keeps drilling into our heads. We've got to be prepared. You're not going to have time if you walk in a dark alley and somebody comes at you with a knife. You don't have time to think about, well, which move should you've got to have reflexes. You've got to be ready to get that arm out there to block that knife, the other hand punching them in the face, followed by a swift kick to whatever body part that they won't enjoy. And you've got to be ready. You've got to be able to do it like this. Your immune system doesn't have time to say, oh, hey, there's a COVID-19 or whatever they want to call it. Supposedly they've already called it COVID-21 out there on some news report. It doesn't have time to decide, okay, well, can I go and get an order of vitamin D from the grocery store, and can I kind of boost up my zinc a little bit? No, it's got to be there. You don't have time. It's like the snowstorms in Tennessee. Once it hits, you're not having time to run to the grocery store. You don't have that much time. Yes, we all do that, but we don't have time. You've got to have your immune system A+, top-notch, boot camp ready for that, so that way it's ready for the acute infection. And I would argue is also less likely, if you fight it off, it's going to be less likely to leave residual effects and having long hauler COVID, and then having to see somebody like me, or going to one of the conventional doctors who just wants to put you on physical therapy, or seeing us where we're going to actually help you overcome that long hauler COVID. So with that, there's a lot more you can do besides just sitting back, a lot more you can do besides getting a vaccine, and a lot more you can do besides just wearing a mask and hiding from the world. You can actually be prepared, just like we do in Krav Maga. You can be prepared with an immune system that is a black belt, not waiting for your white belt to arrive and start your training. So thank you for joining me. I'm going to take one last look to see if there's any questions. Nope, good. So I'm glad, Jimmy, they've not been vaxxed for COVID. And yes, we're right now staying, the preventives we use for COVID prevention are things you can stay pretty much on for years as long as you're not taking too much. Too much zinc can be a bad thing. Too much vitamin D, if you're taking 50,000 a day, you're eventually going to have some high calcium issues and then potentially kidney issues and muscle twitches and other issues. If you take too much vitamin C, it could lead to kidney stones in some patients, and it can also really upset the stomach and upset some bladders from that. So you got to know how to use it, which is again another thing we do in the immune course, is how to use those supplements and how to work with a doctor and how to find a doctor, someone who can guide you in those things so you're not hurting yourself trying to do something good. So again, thank you. I enjoyed it, and I look forward to the next Facebook Live will be coming in September, and I don't have a topic, so if anybody wants to start sending in votes and talk me into something, what we're going to do on September 9th, I'm open to ideas, but I have not made up my mind yet, but we'll see you September 9th at noon for another round of Healthier You on Facebook by Sanctuary Functional Medicine. Have a great week, and look forward to seeing you soon.